On one side, we've got medicine that's been around for centuries. On the other side, let's talk about the other form, digital health, right? So, Mr. Ramani, how can digital health in India help improve access to care and quality of care? Policy Bazaar has been doing a lot of work in that area. Maybe you could tell the audience a little bit more.
I refer to the keynote session we had, and a lot of what we've been speaking, that real effective way to manage population health levels is to actually get to the primary care. Make sure that you handle the issues as and when they arise, instead of letting it grow to a level where it has to be handled only on a tertiary care. And at least from an insurance and a distribution perspective, the last mile was and continues to be a problem in India in terms of accessibility in a lot of places, and wherever there is accessibility. So probably in urban areas, I think accessibility is not an issue. You find a neighborhood doctor almost in almost all good urban areas. But then the ability to go and consult and take advice for niggles, as I'll call it, which tomorrow can lead to something bigger, is lower. So there is both sides of the coin, that there is an accessibility issue and there is a willingness and acceptance issue of going and taking support. What we as a group are looking for, obviously there are models around the world on how to solve this, and digital model has been successfully at least used in one big market, which is neighbor to us in China, where the digital health model has been fairly successful in making sure that a lot more people have access to health, primary healthcare health, and are getting remote help. So that was exactly the model that we saw, and we are entering the digital space where we believe that by providing access through a remote connection, which is through any device you hold through an internet, if more and more people can be brought closer to means nodes that can deliver the medical care. So it's a simple combination of what you call as a telehealthcare or what you can call as doctor over a chat, finally culminating into potentially what we call as a doctor on video. So digital health, we believe, can therefore help cross that last mile and help people more and more open up to the idea of what care they require, where we can intervene and suggest what is the best mode, what is the best step to take in order to handle a given issue that a customer residing in any part of India is going through. Now, what is obviously helping at this point in time is we are going through the revolution where data and accessibility to internet is growing day by day. It is still not up to the level that you would want. It is still not up to the level where the neighboring China today sees it, which has been a great enabler to do that. But it is definitely seeing a big turnaround in the last 12 months, thanks to some of the initiatives that have happened on the ground. We therefore see this is the right flux where digital health can substitute what else is happening on the ground to drive that primary care in a more efficient and effective way to the customers on the ground.
Mr. Ramani,